My name is Derick Johnson. I'm an orthopedic surgeon who practices in West Michigan. We have patients that come from all over the state seeking out innovation, whether that being anterior total hip replacement, which I was a first fellowship trained orthopedic surgeon doing anterior total hip replacement, or whether that's total knee replacement done with the Mako Robotics. Patients are seeking that technology out because there's less pain and quick recovery, where they come in that morning and go home that afternoon, returning back to their activities within weeks and not months. The reason why I got into medicine in the first place was my mother was a longtime nurse at Holland Hospital that kind of led me into the practice itself. Coming to the office every day is very rewarding for me to see patients come into the office several weeks out after hip or knee replacement surgery, less painful, getting back into the activities they enjoy, whether that's increasing their walking distances, whether that's getting back into low impact cycling, swimming, elliptical, or just simple pickleball kind of activities or kayaking adventures that they enjoy and taking on a day-to-day basis. If you're feeling like you have hip or knee pain, it's simply giving us a call, going to the website. We don't need the referral from the primary care office. You can give our team a call. We see each other, have a conversation, see the x-rays, and kind of individualize a plan specific for you.